Well, I absolutely hate to say this, but there is a magic medicine out there in the market which can give crazy results when consumed for weight loss. And guess what? Recently, even Indian government has given approval for the use of the same medicine. Which medicine am I talking about? Before that, there's a small twist. The Indian government has given approval for the use of it only as an anti-diabetic medication, not as a weight loss medication. Confused? Well, let's end all the confusion. The drug we are talking about is Tirzepatide. It is a new anti-diabetic medication. But guess what? The studies have shown crazy results in terms of weight loss when it is used. So as much as 15% of the weight loss has been observed in about 15 to 18 months of its usage. That's crazy, right? Well, it was developed as an anti-diabetic medication. How does it work? It acts on GIP and GLP-1 receptor as an agonist. By doing it, how does it reduce the blood sugar level? It delays the gastric emptying. It reduces the appetite, and it makes the patient feel very full even after a little bit of food intake. So by doing all these things, naturally it's going to decrease the blood sugar level, but quite obvious that doing all these things, it will also lead to significant amount of weight loss. The only catch is that this is not a tablet which you can pop in any time. This is an injection, and usually it is given once a week. So recently Indian government has given approval for its usage in India as an anti-diabetic medication, not quite yet as a weight loss medicine. But can't it be used? Yes. Going by its all the previous study results, yes, it seems to be a very promising drug for weight loss in those who have probably tried everything and are not at all getting any results. But the important question is that even if it can be used as a weight loss medication, can you, should you, would you go for it? To know more about that, stick to this video. And guess what? I am not the right person to talk about this. I don't really deal with this in my day-to-day life. So I have invited a guest who is an aesthetic physician in Dubai who prescribes these medication when required. So let's welcome Dr. Disha Dinakar, also known as Dr. Akshata Dinakar, who is an aesthetic physician in Dubai. Hello, Dr. Disha. Welcome to the channel. Please enlighten us about this medicine, that is Tirzepatide, which has been recently approved in India as an anti-diabetic medication. But of course, going by its results, we know that it can be a very promising weight loss medicine. Have you been using it, and what are the results like?
So Tirzepatide goes by the name Mounjaro, and it is very popular here in Dubai. I prefer using Mounjaro on someone who's obese. So I have prescribed that to few of my patients. And just to let you know, it is not FDA approved for weight loss. It is only approved as an anti-diabetic medication. However, with more studies, it might get approved soon. Results with Mounjaro is crazy. I have seen patients lose a lot of weight, in fact a substantial amount of weight, like 25 to 30 kilos, which is why, as I mentioned, I prefer prescribing this for someone who's obese or who has underlying hormonal issues, which makes it very difficult for them to lose weight, or if they are insulin resistant.
See, whenever we think of any medicine, a very important concern that comes to our mind is what are its adverse effects. But if I go through the study material, they claim that it has lesser adverse effects compared to the other medications of the same category, especially hepatotoxicity and all. But I would like to know your view on that, your experience about the adverse effect profile of Tirzepatide.
So none of the drugs come without side effects, right? There are side effects reported, and personally with my patients, most common side effect what has been noticed is that they feel nauseous, and along with that they also do not feel hungry at all. So even if they are offered something, like if they have to have a muffin or biscuits, when they have like one or two bites itself, they feel super full. This is what I have come across in my patients. So I haven't come across any adverse side effects as such, but I have read about stories of some patients where the drug did not suit them at all, and they were hospitalized because their sugar dropped really low.
See, when it comes to all these minor side effects, most of the time we have these minor hacks with which we try to eliminate or decrease these adverse effects, right? So have you been using any of those kinds in your practice? Do you do anything so that these minor adverse effects can be negated?
So to minimize the risk of side effects, what I usually do is I start my patients on a super low dose and I gradually increase their dosage. They're supposed to take these injections once a week.
See, you know very well that a biggest limiting factor and the biggest concern for any medicine in India is the cost, right? So that becomes a very important factor in deciding a lot of treatments, whether it is diabetes or weight loss. So what is the cost of it in Dubai? What do you think is the cost of it in India? Is it going to be that crazy medicine only the very affluent society can afford, or whether the middle class and the others also will be able to afford this? What do you think about it?
So the cost right now in Dubai for 1 month supply, that's 4 injections, is about 34,000 rupees, and I suppose the cost in India also will be similar. As of now, I wouldn't say it's price cheap, but moving forward, maybe the prices could drop.
Yeah, so we can hope that probably with the time the cost would come down as more and more makers will come forward in producing this injection. See, tell me if you agree with this. I always believe that a bottom line for weight loss has to be good, clean diet, good amount of physical activity, preferably a combination of weight training, cardio, stretching, yoga, everything, and avoiding junk food as much as possible. But yes, this can be a solution to those who are unable to carry out these things because of some other medical problem, or are absolutely not getting any results with all these things. But I believe that one should always try for these conventional methods than go towards using medicines like Tirzepatide. What's your view on that?
I would 100% agree with the fact that Mounjaro should be preserved only for those who are morbidly obese or who have any health issues that is not letting them lose weight. I would not prescribe this as my treatment of choice. I would, in fact, ask my patient to get on a clean and healthy diet followed with a good, active lifestyle. So, if that doesn't work, then we explore more options, and then Mounjaro would be one of the options. I would also request all of you all to only start Mounjaro under a doctor's guidance and go for regular follow-ups. There are side effects that have been reported, minor or major, so it's very important that this is followed up regularly with the doctor, and you only start it at a doctor's clinic and not by yourself.
Okay, that's actually quite informative. Let's hope that the medicine gets used appropriately. Well, of course, as an anti-diabetic medication, and later, if required, as a weight loss medicine for those who are not really getting results with other things. And also, let's hope that the cost will eventually come down, because even 30 to 35,000 per month on this medicine seems a little heavy on the pockets of most of the Indians. Let's see, let's hope for that. Well, thank you so much, Disha, for joining with us and helping the audience to know about this new drug. Thank you so much.